In this segment, we're going to talk about the importance of exercise and sleep for heart health for patients with heart failure. First up, Katie Pate is our cardiac wellness coach, and she has a background in exercise physiology as well as cardiac rehab, senior group exercise, and wellness coaching. She's going to talk about the importance of exercise, how frequent you should be exercising, and she's also going to demonstrate some of those exercises with things that you have around the house to incorporate an easy exercise routine at home. And then to end this session, Kelly is our Wellstar Sleep Navigator, who is going to talk about the importance of sleep and heart health.
Okay, so today we're going to talk about how exercise affects heart health, and we're going to start talking about how heart failure affects the heart itself. Heart failure can either mean that you have a really stiff muscle, a thick heart muscle that doesn't beat very well or doesn't relax very well, or else it could mean that the muscle in the heart is just really thin and it doesn't beat very strongly. But exercise is one of those things that can improve heart health, and we like to say that exercise is medicine. And if you could take all of the things that exercise does for you and pack it into a pill, it would be a widely prescribed medication because it treats so many different things. It can treat cholesterol, blood sugar, blood pressure, it helps reduce stress, it helps you sleep better, and it even improves osteoporosis. There's a lot of great things that you can achieve through exercise. One of the things it does is it strengthens your heart. So when your heart beats, every time it beats, it pumps out a certain amount of blood, and we call that your ejection fraction. And as your heart muscle becomes stronger, your ejection fraction improves. So you're pumping more blood out to the heart, getting more oxygen to the tissue, more nutrients, and it makes you feel better and think better. One of the things that we like to say about exercise is that it improves your independent living. If you're exercising, your balance is better, your strength is better, you're more likely to be able to live longer at your home on your own because you have the stamina to stand and cut your vegetables and take care of your activities of daily living. Exercise doesn't have to be hard, it just has to be often. We use the FIT principle to determine how often and how hard we should be exercising. FIT stands for frequency, intensity, time, and type. So the F, the frequency part, we try to encourage people to exercise every day or as many days of the week as possible, but 4 to 6 times a week is ideal. Intensity is how hard. I should be able to speak while I'm exercising. We use the talk test to help determine how hard we should be exercising. If I can have a conversation while I'm exercising, great. If I can sing while I'm exercising, I'm not working hard enough. But if I'm really out of breath while I'm trying to exercise, I know that I'm working too hard. So if my friends were to ask me while I'm exercising, Katie, how are you doing? If I can say, I'm doing pretty well, then I know that I'm exercising within the range that I want to be in. But if someone says, how am I doing? And I have to say, well, I think I can make it for another minute, then I know I'm working way too hard. So the next element is time. How long should I be exercising? We encourage people to work between 30 and 45 minutes for good heart health. 30 minutes is great to help improve your heart strength, but if you're trying to lose weight, 45 minutes is ideal. The type is going to be aerobic, and that's going to be rhythmic motions. And so walking, cycling, swimming, dancing, all those things are good for improving your heart health and staying in that aerobic zone. Strength training. So we encourage people to lift a weight that they're able to lift from 12 to 15 times. So if I'm lifting a heavier weight, it actually will help the muscle respond, but it's a little bit hard on the joints if you're first starting to exercise. So as you start, focus first on using lighter weights and higher repetitions. So I might be using a light weight and lifting 12 to 15 times. The muscles will respond. They've done studies in people who are in their 80s, and even though they had never exercised before, the muscles responded just as if they were 20 years old. So the people in this study were able to triple their strength in 6 weeks with the right exercises. So exercise can happen. What we're being careful of is the joints. The joints need a little bit of time to catch up and decide that they want to be on board with this whole thing. So that's how we're going to start. 8 to 12 muscle groups a week, and 2 to 3 times a week for strength training. So one of the exciting things about strength training is that it does make your muscles bigger. But before that ever happens, the first thing that happens is that you build new nerves to talk to your muscle cells. So if your brain is sending a signal to your muscles to pick something up, It might just be sending a muscle through one or two different nerve cells. But as I lift weights, I get new connections talking to my nerves. So instead of 2 nerve cells talking to my muscle, maybe I have 5. And so now lifting something up becomes easier only because I have more messages going to more of those muscle cells, and it just makes it easier. What should an exercise session look like? So we always start out with a warm-up, and you want to use the same movement that you're going to be using for your exercise bout. So if I was walking, I might start walking slower. If I was riding a bicycle, I would just pedal lightly with a light gear, and I'm going to spend 5 or 10 minutes warming my body up so that I'm getting ready to exercise. That makes my heart rate goes up and prepares my body for stronger exercise. My cardio exercise is going to be next. After my cardio, after my muscles are warmed up, I'm going to be using strength exercises, and after that I'll be doing a cool down. The cool down is a really important part of your exercise bout. It allows your heart rate to come back down, it allows your blood pressure to come back down, and it makes you ready to go on with your day. Finally, we're going to finish up with a stretch. You want to do a stretch while your muscles are still warm, because just like Play-Doh, when your muscles are warm, they'll stretch a lot better. If your muscles are cold, they don't hold up so well to stretching. So what kind of exercise is best? The best kind of exercise is that exercise that you like the best. It's that thing you really enjoy, because if you love doing it, you're really going to enjoy your exercise. You're going to do it more often. You'll stick to your program. For some people, that's Zumba, because people who won't do any other kind of exercise will Zumba. But it might be Tai Chi, it might be water aerobics, it might be a class that you can go to at the community center or the YMCA. It might be you're in front of your TV and you're watching a YouTube video. Whatever works for you, whatever works in your schedule. If it keeps you exercising on a regular basis, that's the best kind of exercise for you. So now I'm going to show you some of the exercises that you can do in your own home with things that you have laying around the house. So now I'm going to demonstrate some of the exercises that we encourage people to do, where we deliberately are using equipment that you might have at home. So for example, we were using paper plates for your cardio exercise. We even have a ball of yarn if you don't have a ball in your house. If you don't have dumbbells, you can use cans or you can use water bottles. Whatever you have at home works. So if you were to go to the gym and you were to work out an exercise routine, we would always do your big muscles first. So that's your chest, your back, and your legs. So the first exercise we're going to do is called sit to stand. I'm going to give you a seated exercise in a minute in case sit to stand doesn't work for you, so you'll get the seated and the standing version. So now I'm going to demonstrate some of the exercises that we're encouraging you to do. If you remember how this works, we always start with our warm-up first, then we're going to do a little bit of cardio to get the muscles warmed up and to get the blood flowing. We'll do a little bit of strength training, and then we're going to do our stretches at the end. And that's how we always want to do it. Okay, so for our, to begin with, let's just warm up a little bit. We just want to get the muscles moving. So I'm just going to go through what we call the range of motion. Whatever that joint does is what we're going to do. So I'm going to roll my shoulders back, because that's what shoulders do. Very nice. I'm going to roll them forward. How about both of them together? Very nice. And you can make this longer if you want to. Sitting really tall in my chair, and I'm just going to turn my head from side to side, warming up my neck, side to side, just like I'm saying no. Then I'm going to look straight ahead. I'm going to drop one ear to my shoulder, roll my chin to my chest, and then roll my other ear to the other shoulder. Drop your chin to your chest, and we're just going to roll your head back and forth. So notice I'm not looking up. I'm just rolling my head across my chest. One more time on each direction. Very nice. And I just want to get a little twist in, side to side. I'm going to look over my shoulder as I do. If it makes you dizzy to do that, just look straight ahead and just move the upper body. Nice. Okay. So let's go ahead and get our paper plates out. If you have carpeted floor, a paper plate works really well. If you have a hardwood floor, sometimes it's better to use like a towel from your kitchen, just something to make your feet slide easily. So I'm going to just start by moving my feet back and forth. And I'm just warming up my legs, getting a little bit of cardio going as well. And I'm making this nice and slow. I'm using just my legs right now. In a minute, we're going to add arms. You can go out side to side if you want. Lots of different things you can do. And I won't teach the whole class because we don't have time for that, but I'm just giving you some ideas for things that you can do. If I wanted to add arms, I could do jumping jacks. And if I was keeping my feet forward and back, I could just pretend like I'm running in place. All good ways to warm up your muscles. So to do that, I would probably do 5 minutes, maybe even 10 minutes of just moving around, maybe stretching it out, using the muscles in different ways, just to get them all warmed up. Very nice. Okay, so you can make it go faster if you want. I can go really fast, but again, I'm gonna make sure that I get that full warming up first. Okay, so let's say we've gone through and we've done 5 to 10 minutes of our cardio exercise just to warm up. I'm gonna put these out of the way because I do not want us to be stepping on those because they're gonna slide. Okay, so this is where you're gonna reach down, you're gonna grab your water bottle. If you have them, you're gonna grab a dumbbell. Dumbbells are nice. These are plastic coated, so they're really easy to clean. And they're actually not very expensive. Typically, they're $1 a pound. So 5 pounds typically costs $5 for one of these. So look around because you don't have to pay a lot of money for them. Another thing to think about is if I have arthritis in my hands, sometimes it's easier to use a ball. This is a weighted ball. It's covered with the same plastic. And I can get these in anything from 1 pound up to 10. And I could use it just as I would use a dumbbell. So if you have arthritis in your hands, the ball is a nice option. Okay, so we'll put this out of the way. Put my dumbbells out of the way, and we'll start with our first exercise for the lower body, and that's our sits to stands. I like this exercise because it gets 3 muscle groups all at once. Putting my feet nice and wide for balance, and I'm just going to stand up out of my chair, and I'm going to sit nice and slow on the way back down. Flopping is not allowed. So I'm going to have you stand up and have a seat. So I'm really lucky because I'm actually pretty short, and this chair, when I sit in it, makes my knees bend exactly to 90 degrees. So for me, this chair is perfect. If you're 6 foot tall, you might want to put a cushion under your chair to raise your hips up so you're not having to come from quite so low. So for that exercise, we would like for you to do 8 to 10 if you can. If you can do more, even better. But definitely 8 to 10. If you're not able to do 8 to 10, you might want to instead do a seated exercise. So I'm sitting on the edge of my chair, sitting really tall. I might just march in place because I'm lifting my legs. This is a great way to strengthen your legs. If that feels too easy, I'm going to turn a little to the side so you can see me a little better. I can straighten one leg stays bent. I'm just going to lean back, let my shoulders touch. I'm going to draw my belly button in. Holding onto the chair if you need to. I'm going to lift this leg higher than this one. So I'm just going to lift it up and tap it down. It helps to breathe out. You're going to breathe out on the hard part. Exhale to lift, inhale to lower, and I'm going to do 8 to 10 of those on both legs. So if you can't remember when to breathe, just remember not to hold your breath. Keep breathing. Okay. So if you're doing your sits to stands and you come out of your chair, don't sit down because our next exercise is also going to be standing. So I'm going to stand behind my chair this time. I'm going to turn it sideways so you can see me. And I'm going to work on my calf muscles. I need strong calf muscles for good balance. Using my chair to hold on to help my balance. And again, my feet are wide. I just want to come up onto the balls of my feet like I'm wearing high heels. Easy on the way back down. Up onto the balls of my feet, easy down. And I'm going to do, again, 8 to 10 of those exercises. So that exercise is really great for helping to prevent falls because it does improve your balance and improve your strength. Okay. So another exercise we can do is a wall push-up. I like it again because it uses so many different muscle groups. It works your chest and the back of your arms, also your core muscles. So we have a picture of that. You can do your push-ups off the wall or off the back of the couch, however it works for you. The lower you can go, the more strength training you'll get. You want to make sure that you can do 8 to 10 of those because if you can't do that many, it's a little bit too hard. Okay, so our next exercise, we're going to use a band for. I'll show you the dumbbell version in just a minute. The band is ideal for this exercise. I'm going to put it under 1 foot. My hands are pretty low because we're working a really strong muscle in your back. We're working your lentissimus dorsi. So I hold here. I want to keep my chest up. I'm looking straight ahead of myself, maybe 3 feet beyond my toe. I just want to pull straight back and easy forward. So notice my wrists are not doing this, right? I'm keeping my wrists straight, pulling back, leading with the elbows. Just like that. Perfect. Okay, so you can also use a band like this one, but if you use a round band, make sure that it's around the narrow part of your shoe because if it comes up behind your toe, this is a big rubber band and it will come up. That was not even an accident, it just happened that way. So this is a nice alternative. I'll put that out of the way. Okay, if I wanted to use dumbbells to work those same muscles, it really looks the same way. So I want to lean forward because I want to work against gravity. I'm going to reach forward to the ball, to the toes of my shoes, pull straight back, leading with the elbows, and it gets that same muscle, the same movement, just a little bit different way. Okay, so I'll put that down. If you still have the band in your hand, we're going to work the back of your arms. So again, I'm going to turn sideways so you can see this. We're going to work your tricep muscle, this muscle in the back. I'm going to start by placing my hand right here. My elbow is bent, and I'm just going to push straight back. And this focuses on the back of your arm, just like this. This keeps us from waving twice. Nice. Okay, so that works. We worked our leg muscles, we worked our back muscles, we worked the back of the arm. Let's work the front of the arm. If I was using the band, I could just do this way. And again, notice my foot is resting on the floor. The same motion is what we use if we're using dumbbells. So this one, same thing. I'm sitting on the edge of my seat. I'm not leaning back and touching the back if I can help it. Roll the shoulders back. My hands are here. And I'm just going to exhale as I lift to the shoulders. Inhale twice as slow on the way back down. Nice. Inhale up and exhale down. I should be able to do 10 or 15 of these. If I can't do that, the weight might be a little bit too heavy. And if that's the case, I'll just switch to a different weight. Okay, so I wanted to give you an option for the triceps because that was the one where we were pushing back like this. You can do that same motion with a dumbbell. So same idea. I'm going to lean forward just a little bit, lift this elbow. Be careful not to let this elbow drop because a lot of people want to do it this way. But I'm going to keep that elbow here and push straight back. Nice, and I'm focusing on the back of the arm. Nice. Alrighty. So we've got your arms, biceps, and triceps. Next, we want to do your shoulders. So again, lots of options here. The most basic version of this exercise is to put your hands straight in front of you and just lift your arms like they're chicken wings. So I'm going to lift them up, and if I had cans of beans, I'd be pouring out the beans. So I'm lifting up my elbows, pouring out the beans, just like this. That's the most basic form of this exercise. If I found this exercise was too easy, I can just lift straight out to the side. So I'm making sure my arms are not locked. They're a little bit soft. I'm going to take my arms straight out to the side. I'm not going any higher than this, just to level and back down. Going out and back down. Nice. I can add to this if I want to by lifting to the front. So this is going to get two different parts of that shoulder muscle. So I'm going to lift up and down, and then I'm going to lift to the front. So notice my palms are facing each other. I'm lifting out and down and to the front. An important thing to think about is that when I'm lifting out to the side, this wrist is not this way. I'm keeping it really solid and strong. So that's going to go both to the front and to the sides, and that gets your shoulder muscles. Let me give you one last exercise for your calf muscles, because we did a standing calf exercise earlier. I want to show you the version that you would want to do if you're working on your calves from a seated position. So I have my hands right here. I can use my dumbbells if I want. I'm just going to lift up my heels as high as I can go and easy back down and lift and lower. If that felt too easy, I could just lean forward, put my weight into my knees, and it's the same exercise. So it's a little bit easier than standing, but I'm still lifting part of my body weight. Okay, so our strength training session's over. We want to get a little bit of stretching in. We want to stretch all of the muscles that we just worked. So I'm going to start with a stretch for my legs. I'm going to sit on the edge of my chair, straighten out my leg, my toes pointing to the ceiling. There's a couple ways to do this. I can just slide my leg down my leg, my arms down my leg, and get a nice stretch for the back of the leg. If you have a ball, you can use the ball to help. I'm using a ball of yarn because that's what I have at home. You can roll the ball down, and it really helps to focus just a little bit so that you get a nice stretch for the back of your leg. And roll it back up. If you want to lower your foot to the floor, when you roll the ball down, you'll get a stretch on the top of your foot and the top of your shin as well. I'm even getting a stretch for the back of my shoulders. If I have low back pain, instead of going all the way to my toe, I'm going to keep my back really straight. So as opposed to going this way, where my back is bent, I'm going to keep my back really straight, and I may only be able to get to here, but I'll still get the stretch in the back of my leg. Very nice. Okay, let's get a stretch for the front of your leg. This time I'm going to turn sideways in my chair, holding onto the back of the chair, taking a big step back, tucking my toe under if I can, but if I can't, I'll just turn my shoelaces to the floor. I'll still get the stretch. Lean back a little bit, you'll get a stretch right here. If that causes you to cramp, just step out of it. Okay, so that's our legs. I'm still sitting on the edge of my chair. I'm gonna lean back, let my shoulders touch. I'm gonna pull this leg in so I get another stretch and roll the ankle around. Remember, you're doing this on both sides. I'm just demonstrating the one. I'm gonna go back the other way. Nice. Okay, for upper body, let's get a stretch for your shoulders. Just wanna put one hand to the opposite shoulder. This hand is gonna push the elbow so I feel the stretch in my shoulder. I'm gonna look and turn my head over the shoulder I'm stretching. Same thing to the other side. Nice. Turn my head. Very nice. How about a stretch for the chest muscles? I'm gonna put my hand to the back of my neck, push the elbows back, and I'll feel a nice stretch in my chest. Exhale and bring your elbows together. And that's one you want to do a couple of times because you want to, once that muscle is warm, you get a little more stretch from that. Finally, I'll turn my head from side to side, just like we did before. Nice. Take a big deep breath in. You're going to exhale out, and if you can, you're going to touch your knees, your hands underneath your knees. Helps if your knees are touching. Inhale again, and we're done for today.
I'm Kelly Gladden. I'm the sleep navigator for Wellstar Sleep Centers. So Wellstar Heart Failure Academy, sleep health, promoting resilience with better choices and better health. How obstructive sleep apnea impacts cardiovascular disease. Signs and symptoms: snoring, witness apnea by the bed partner, episodes of gasping or choking during sleep, dry mouth or dry throat in the mornings, insomnia with repeated awakenings, excessive daytime sleepiness, non-refreshing sleep, morning headaches, difficulty concentrating, memory impairment, irritability and or mood changes, frequent trips to the restroom during the night, or a decreased libido or erectile dysfunction. So what is obstructive sleep apnea? Obstructive sleep apnea, or sometimes referred to as OSA, occurs when the upper airway repeatedly collapses during sleep, causing a complete stoppage of breathing, which is an apnea, and some sleep fragmentation. An apnea is defined as stopping of your airflow that lasts for 10 seconds or longer. A hypopnea is similar to an apnea, but there's a reduction in airflow by 30%, with an arousal that occurs with our brain, and our oxygen will decrease. During sleep, there's a reduction of tone of the dilator muscles involved in keeping your airway open. So I have a picture. On the left side is a picture of a normal sleep patient. You can see how the blue arrow goes from the nose straight through the throat. There's no blockages. That's how we should all be sleeping at night. But if you look at the picture on the right, that's an example of obstruction. You see how the tongue rolls back. You actually have a picture of the blue arrow, but it gets stopped. That's what causes obstructive sleep apnea. So for heart failure patients, sleep apnea is highly prevalent in patients with heart failure, with studies indicating a prevalence between 50 to 70% of the population. Central sleep apnea accounts for approximately 2/3 of this population. Central sleep apnea has also been associated with Cheyne-Stokes breathing, which is characterized by periods of hyperventilation and hypoventilation and central sleep apnea that can impact our carbon dioxide levels when we sleep. Then there's something called periodic limb movement syndrome or disorder, where patients will uncontrollably move their legs during the night. And a lot of times they don't realize this is happening unless their bed partner is telling them they're kicking all night. And there are studies that have shown that PLMD is a contributor to developing cardiovascular disease. So an in-center sleep study is the gold standard for this population because we capture the legs and the EKG. If you look at the top picture, there's those little black blips. That's examples of someone kicking their legs all night long when they're sleeping. The picture below shows an example of central sleep apnea, where you have an example of the flow where there's no breathing. And then our rib cage and abdominal belts, there's no movement with our chest wall. So we're literally not making any effort to breathe. And if you look at the SpO2, that's our pulse ox, that's our oxygen. So when we have these events, our oxygen tends to drop. And if you look at the EKG above, you can actually see how it was looking like it was normal, but when the central sleep apnea occurred, bradycardia occurred. So you can see how the heart rate has slowed. So what is central sleep apnea? Whereas obstructive is caused by an obstruction of our airway, from the example I've shown, central sleep apnea is not caused by a blockage of the airway. Central sleep apnea, the brain doesn't send a regular signal to the diaphragm to contract to expand. There's usually no snoring in central sleep apnea patients. It has been associated with brainstem stroke because the brainstem is where the impulse to breathe comes from. So many patients that have cardiovascular disease or congestive heart failure are often overlooked because he or she do not present as a typical obstructive patient that's obese. They present as fatigued, but the fatigue is assumed to be caused by the cardiac disease, and there's usually no snoring. So what is the best way to treat central sleep apnea? CPAP bilevel is the gold standard. However, central sleep apnea is a little bit more difficult to treat. There's a CPAP unit called adaptive serval ventilation, or we call it ASV. It's created specifically for the treatment of adults who have central sleep apnea or complex sleep apnea. The only thing is, though, ASV has recently become contraindicated in patients that have left ventricular ejection fractions that are under 45% with moderate to severe predominant central sleep apnea. So how do we treat heart failure patients who have central sleep apnea but they have ejection fractions less than 45%? There has been a new implantable device that came out in the market. It's a phrenic nerve stimulation. It's a Remedy system, and it's from Respicardia. But Dr. Canaroo is a cardiologist at Wellstar Keystone that has been trained to implant this device. Wellstar is the only hospital in the state of Georgia performing this procedure. The device will stimulate the phrenic nerve and generates a negative pressure to activate the diaphragm to breathe normally. 91% had a reduction in the number of sleep apnea events in 12 months, and 79% reported an improvement in quality of life. So for more information about the Remedy device, you can look at respicardia.com. And last, the Stop Bang questionnaire is a questionnaire that you may see more of as you come to some of the Wellstar facilities, because we are starting to screen for sleep apnea because we're realizing patients that have cardiovascular disease, a lot of times our medications don't work as well if we do not get our sleep apnea under control. So it's a simple question, yes or no. Do you snore? Yes or no. Do you feel tired during the day? Yes or no. Has anyone ever told you stop breathing, or have they seen you gasp or choke, or have you caught yourself stop breathing? Yes or no. Are you being treated for high blood pressure? What's your body mass index? Is it more than 10% over your ideal, which is a combination of your height and your weight? Usually if it's greater than 35, your ideal body weight, that's an issue. Are you older than 50 years old? Is your neck size greater than 16 inches for a woman, 17 for a man? And are you a male? If you answered yes to 3 or more questions, please consider speaking to your cardiologist or a pulmonary sleep specialist about improving your sleep health. And thank you for your time.
Thank you to Katie and Kelly for those awesome tips. I hope you all have learned some new things to get you started, and you feel excited to exercise and start a new program. And I hope you've learned some things that will help you get a better night's sleep, and you'll wake up and you'll feel better and rejuvenated. Thank you all for tuning in, and be well.